Let's talk about asynchronous telehealth, which is also called text-based telemedicine. Hi there, welcome to our telemedicine clinic. I am Dr. Harrison. We are the biggest telehealth clinic in the United States, a clinic that puts your primary care needs first. Our health team is available via telephone and video to assess your symptoms and create a care plan specific to your needs. There are a lot of different use cases and ways to stratify telehealth, including by modality. One such modality is asynchronous telehealth, also known as store and forward. Text messaging, email, Slack, and online forums are all examples of asynchronous communication technology designed to allow for a fluid dialogue that may ebb and flow, and not constrained to a specific window of time. Text messaging is the primary modality for asynchronous telemedicine and is used across the care continuum by primary care providers and health systems. So, what is asynchronous telehealth? Asynchronous telemedicine can refer to a few different use cases. In one scenario, assets like a patient's health information, images regarding their condition, and reports can be forwarded to a physician and stored until the doctor has time to review them and render a diagnosis. This store and forward approach is popular with specialties like addiction medicine, bariatrics medicine or weight loss, radiology, dermatology, and ophthalmology. The more frequent scenario for asynchronous telehealth is text-based communication between a patient and a provider. Some telehealth services first require that patients interact with a chatbot or AI intake process, and then provide a preliminary diagnosis to a clinician to follow up on. Other asynchronous telemedicine solutions like this clinic provide direct communication between patients and physicians. So, what are the benefits of asynchronous telehealth? Text-based asynchronous telemedicine can allow patients immediate access to healthcare professionals rather than requiring an appointment. This is particularly appealing to self-funded employers with deskless workforces, whose work schedules or job functions don't easily enable them to participate in video visits. This includes industries such as education, energy, heavy industry, retail, and transportation. Because text-based telehealth is immediate and direct, patients do not need to waste time in virtual waiting rooms. As with any other text messaging, text-based exchanges between patients and clinicians at asynchronous telemedicine services are discreet and can be conducted on the go, even when surrounded by others, such as in a break room, on public transit, or waiting in line. Text-based telehealth doesn't require a broadband connection. This is especially important in expanding access to healthcare for patients without reliable broadband, including rural residents, as well as Medicaid and Medicare populations. For all the reasons I have listed so far, this telehealth clinic takes a text-first approach to providing virtual care. That means that all of our consultations start by text, but can easily transition to video or audio sessions if necessary. We find that the asynchronous nature of text-based telemedicine enables our doctors to check back in or have patients follow up in an organic way that doesn't exist in any other modality. Patients are no longer constrained to one short window of time to communicate with a doctor, and healthcare professionals are no longer confined to a 15-minute consultation to render a diagnosis or care plan. We take an integrated approach to care delivery. Patients who need care are often unsure where to begin. Is their condition something a primary care doctor can address? Do they need a specialist? Should they go to an emergency department? This telemedicine clinic makes it easy. Patients begin their health encounter with a simple text message that immediately connects them with a board-certified physician who guides them to the right setting for care. If needed, our physicians can direct patients to specialists or refer them to in-person care. To make an appointment, please send a text to 866-682-6983. All you need is a smartphone, computer, or tablet. A medical doctor will see you from the comfort of your home. Your script will be sent electronically to your local pharmacy. Alternatively, it can be sent to our mail order pharmacy. The pharmacy will deliver your medication to your home within 2 to 3 days. Again, to make an appointment, please book online or send a text to 866-682-6983. Thank you, and have a wonderful day.